Good morning, good afternoon, and good evening. I will be presenting a tech talk for my course in the management of modeling and simulation. My name is Sharon Campbell, and the focus for the talk is on skill decay. Use it or lose it. The agenda will be we will discuss the background and introduction, the significance, prevention, and conclusion. But before we get started with the background and introduction, allow me to share some definitions with you. So, what are skills? They are defined as well organized performance requiring coordination of perception, cognition, action to achieve a specific goal. Every profession has skills that are provided during their basic training as a baseline. However, we find when we do not use these skills, they decay, or as we say, use it or lose it. So, skill decay is defined as a loss of acquired skills or knowledge over time that results from the lack of consistent use, and it is a well known occurrence among all human beings. Every human being has it. So, there are two types of skill decay you have your absolute and your relative. Absolute is that loss of skills from a prior baseline. So, you've been trained in this field, you know this field, that is your initial baseline training. Then you have what's called relative skills. Well, those are skills that we have that as new knowledge come available to us, we still stick with our own knowledge. Our focus though will be on the loss of skills from the prior baseline, thus the absolute. So as we look at things, settings impact these skills. You could be in a community hospital versus a medical center. Medical centers might see multiple trachs and multiple chest tubes, multiple times where they're having to perform cardiopulmonary resuscitation compared to a community hospital. Our nursing, our military, and inside a non-combat area, they don't utilize the immersion skills training that they get when they all have to take trauma nursing core curriculum or the core course that's offered by ENA. Studies have shown us surrounding cardiopulmonary resuscitation and advanced life support that these skills end up declining within 6 months of having received the training. So, what? Why do we care? Well, patient harm. The decline in these skills that we have can result in patient harm, such as CPR. If we forget that we need to go ahead and give compressions at a rate of 30 to 2 while we're alone, if we don't push hard and push fast, we can end up causing that patient not to receive the necessary blood flow through their body and their heart to oxygenate them, to help them be able to survive that arrest. This results for us as healthcare professionals a decrease in our confidence as well as being competent in these areas. So, what are some of these skills that are baseline? Well, we kind of touched on some of them. Cardiopulmonary resuscitation. So, as you see in that one picture, you have people performing basic life support on a patient. Chest tube management, the ability to know what to do as you're setting up the chest tube, knowing that bubbling and chamber and the C-section indicates that you got an air leak. Thus, you got to take care of your patient. Knowing how to do trach management or inserting a Foley or even placing an IV can end up causing harm to patients if we fail to remember how to do these skills or take care of them. And some of it isn't even within our own purview, As we mentioned, you can be in a medical center where they have phlebotomists who comes up and takes care of your labs, manages that. And so you as a nurse may never have had to insert an IV, but you learn it in nursing school. So what things as a medical trainer, as us learning how and wanting to help our profession predict the skill decay? And is there a model that can help us with training our professionals and maintaining these skills? Well, actually, there are. There are two best predictors of skill decay, one being the duration of non use, the other being task characteristics, such as is the task complexity? Is it a huge mental workload on us? Are there any models then that can help us or guide us in how to do the skill or what skills decay should we end up focusing on? Well, in 1984, Rose and colleagues developed this predictive model, and it was designed specifically for U.S. military trainers. It was an evidence based approach that got us to refresher training that might be needed, along with us asking questions such as um, what tasks might likely be retained or lost due to skill decay? What percentage of operators will be able to perform a task accurately after several months? We can make that 2, 3 months, 6 months, 9 months, 12 months without practice. Additionally, when and how often should we conduct sustainment training to end up helping us? This predictive model actually has become very widely used in other professions because it has high validity and reliability. It includes great inter-rater scores and correlations that are predictive in actual performance. We also should have that it has empirical research that exists regarding its applicability and practicality. Once we have this knowledge, then we can look at interventions such as simulation-based learning to help retain these skills, both performance and cognition. At our facility, we recently chose to go with simulation in a nursing aspect of it. Now, don't get me wrong, we have a STEM center, but our focus didn't have our mannequins that cater to nursing. So we were able to end up implementing what we call NEST, that stands for Nursing Education and Training, that aids our nursing team to maintain those skills. And though we're in the primary phase of this, we definitely believe this will lead to operational competent and confidence in nurses. Some of the simulators that we have are Nurse N in the bottom. Nurse N can end up being a adult female, a geriatric female, a male, and a geriatric male. We have all four to end up helping us. We also have the Sim Baby with trach that can end up helping us help our nurses maintain high flow with care. We can also set Sim Baby or Nurse in to detached trainer that's located in the upper right hand corner, um, that allows us to look at our critical care, having our patients on ventilators and having our nursing team have to manage that. We also can end up bringing in our respiratory therapists into this training. Um, so some of these are very specific to us, such as maintaining the trach, doing chest tube management, having enemas, or managing colostomies. These are very beneficial to nursing to help us to be able to maintain our skills. So I want to thank you so much for taking the time out today and giving attention to my tech talk. If there are any questions, please feel free to leave them in the comments sections. If not, then please know that this ends my Tech Talk for Management of Modeling and Simulation course, and my references are available right there. Please have a wonderful day and good luck to everybody in this course.